Are you having to wait for weeks to see your doctor, and then are you limited to only one issue at a time and have only 10 minutes with your doctor, and sometimes not even your doctor or a mid-level or someone that you never even met before when you were really hoping to see the same person? It seems like regular healthcare doesn't even take those complaints seriously anymore. Like getting a on-time quality appointment with a doctor that you already know and trust is just an impossibility. And I didn't want that as a doctor on the other side either. I mean, I had just come from years in the Air Force where I was taking care of pilots, their families, other air crew as best as I possibly could because they were saving lives out there. They were out there doing the mission of the Air Force. The last thing I was going to do is put them off for weeks before I would see them. That wouldn't make any sense at all. So how could I transition from that to a medical world where I brush off my patients and don't take them seriously or can't get them in, or I'm just trying to see as many patients as I possibly can. So even though my heart's in the right place, it's just not allowable for me to take care of people the way I want to in the healthcare system. So I wasn't having any of that. So when I heard about direct primary care, that's exactly what I wanted. I wanted to be able to take care of a smaller number of patients who, for a reasonable monthly fee, could keep my overhead way down by not having to bill insurance. It's amazing how much regular doctors have to have additional staff members and additional hours themselves that are just spent on getting paid by the insurance companies. By being able to cut that out, it just changes healthcare entirely. And it's not, I mean, a concierge practice where you pay hundreds of dollars a month to have a doctor at your beck and call for whatever you want. That's not how it works. I'm available by text message and email, but my patients also understand that I have a life, I have a family. They're not going to call me at 2 a.m. about their hiccups that won't go away. They're very respectful of my time, and in return, I can really give them the care that I've always wanted to give. But I'm also a middle school teacher by background, so I made these videos on my YouTube channel here because I just got sick of the disinformation, the things that I tell my patients every day, but the average person out there is Googling and finding weird answers too. So these are my answers as a physician who's seen a lot before, but you should obviously consult with your own doctor before making big medical decisions. But you should definitely check out direct primary care doctors in your area.